Hey everybody, welcome back to LX News Now. I'm Eric Alvarez, here to talk to you about something really important. You see, today is September 1st, meaning, of course, Labor Day, Hispanic Heritage Month, and all things pumpkin spice are right around the corner. But something else really big is happening right now, because today kicks off National Blood Cancer Awareness Month. Now, some of you might be wondering, well, what exactly is blood cancer anyway? Well, let's check in with the experts at Bristol Myers Squibb. Now, they say, like all cancers, these are characterized by the overproduction of abnormal cells that our bodies usually detect and eliminate. And there are three main types of blood cancers. You've got leukemia, lymphomas, and myeloma. But unlike other types of cancer, these that we're talking about don't form solid tumors the way a lot of us think about cancer. Instead, the cancerous cells in the blood or the bone marrow or the plasma affect the normal production and function of healthy cells. Now, according to the Leukemia and Lymphoma Society, one person is diagnosed with leukemia, lymphoma, or myeloma in the United States every 3 minutes. And right now, an estimated 1.5 million people in the United States are either living with or are in remission from blood cancer. And while survival rates have significantly improved in the last 20 years, approximately every 9 minutes, somebody in the United States dies from these diseases. Another thing that sets these kinds of cancers apart from those you hear about more often is there aren't really a lot of effective screening processes to catch them early. For example, routine mammograms help doctors detect breast cancer early. Same goes for colonoscopies and colorectal cancer, but not so much for blood cancer. So as a result, people don't typically know something is wrong until they start to experience symptoms. And that is why awareness is key. So we're bringing in Dr. Navneet Majhail, Deputy Physician-in-Chief of Blood Cancers for the Sarah Cannon Transplant and Cellular Therapy Program. Thank you so much for joining us today.
Yeah, good morning. Glad to be here.
So what should people know? What can we do to better detect these kinds of things early?
So, Eric, that's a good question. And from that perspective, it's a couple of things that I would ask your viewers to be aware of. So one, these cancers tend to occur mostly in older people. So as we age, our bone marrow ages as well. And that's when there's an increased tendency to see these cancers. But having said that, these cancers can happen in any age group. And I think one of the things to keep in mind is just awareness of some of the symptoms that commonly occur with these cancers. So again, your statistics were very spot on. These cancers are more common than what people realize. And these symptoms that are often associated with these cancers are symptoms such as unexplained weight loss, unexplained fevers. People may have these swollen lymph glands in the neck, in your armpits, in your groin. If you're feeling fatigue persistently for a long period of time, which I think many of us are anyways with all that's going on, it might be time to ask your doctors to see if there's any testing or any other investigations that need to be done to figure this out.
So it might seem obvious to medical professionals out there, but there's obviously a concern if that happens and doctors find out that, yes, a person in fact does have one of these types of cancers. But at that point, aren't we in a situation where it's pretty far advanced? Isn't that a major concern?
So I think one of the main take-home points for this conversation, I hope I can get across to your viewers, is that blood cancers is not necessarily a death sentence. With the advantages in treatments, all the technologies, the medications, the clinical trials we have in the current day and age, we have survival rates of more than 60 to 90%, depending on the type of blood cancer, for most of our patients over 5 years and even longer. So we can either cure many of these blood cancers with what we have today, or we can make them very treatable, where they can be controlled for a very long period of time.
You know, that's certainly encouraging to hear. However, I imagine that the earlier that you can find out and get that treatment, the better. So with that in mind, you know, every October we see football players in the NFL wearing pink, and other months have colored wristbands, colored shirts, and things like that. So why is it so important for blood cancer to have more public awareness as well?
So again, you're spot on. Even though we can cure many of these blood cancers or treat them very effectively, the sooner we can diagnose them, the better it is for our patients. Because the sooner we can start treatments for this earlier in their stage or their natural history, we have better outcomes for our patients as well. And that is where the awareness of symptoms, the awareness of the fact that these cancers are more common than what people recognize or realize is a first step to getting there.
Now, Dr. Majhail, this conversation we're having is great in reaching out to people who don't already know much about blood cancer, but I wanted to shift our focus, if we can, just for a moment to those who know about blood cancer all too well. I mentioned earlier, with 1.5 million people in remission or currently fighting that fight, what would you like them and their families to know?
So for our patients and their families who are dealing with blood cancer in today's date, I think I would say a few things. I'll encourage them to keep a few things in mind. One, again, as I emphasized before, having a blood cancer does not necessarily mean that it's a death sentence. We have effective treatments for them. The second thing I would suggest is if you have blood cancer, ask your oncologist or your doctor to see if a second opinion from someone who focuses on blood cancer, specializes in blood cancers, is a possibility. And the third thing I would emphasize is ask for clinical trials. So see if for their specific subtype of blood cancer, what they're dealing with, is a clinical trial an option for them as they think about their treatment options.
All right, it is important advice, and coming on to spread that awareness message. Can't thank you enough, Dr. Navneet Majhail. Thank you for joining us today.
No, thank you for having me.